Professor Han, can you hear you? Can you hear us? Andrés, ¿puedes ya dejar de compartir tu pantalla y cámara para dar la bienvenida al doctor Han?
Listo.
Gracias. Profesor Han, estamos esperando que el profesor Han se conecte. El profesor Han Jingyan nos acompaña desde la Federación Mundial de Sociedades de Acupuntura y Moxibustión de la WFAS en China. Él trabaja en la Universidad de Pekín de Ciencias de la Salud. Hemos estado conversando con la WFAS y ellos van a ser parte de este simposio. Professor Han, can you hear us now?
Okay.
Okay, thank you a lot for being with us and for being part of this symposium.
Okay.
So Professor Han will do a lecture about the perspective of the traditional Chinese medicine treatment in different febrile disease and a discussion about the mechanisms of the Chinese medicine in the treatment of different clinic case of COVID-19. Professor Han is a Tenured Professor and Chairman Department of Integration of Chinese and Western Medicine in the Peking University Health Science Center Dean. Also, he is part of the Academy of Integration of Chinese and Western Medicine. And like I told before, he is part of the World Federation of Acupuncture-Moxibustion Societies, who is a non-governmental international union for Acupuncture-Moxibustion societies that builds official relations with the WHO, the World Health Organization. Please feel welcome to this symposium, Professor Han.
Thank you, Chair.
Thank you.
Thank you, Chair, for your introduction. I'm Jingyan Han from Beijing University Health Science Center. Today, on behalf of the World Federation of Acupuncture and the Moxibustion Society, I would like to talk about the advantage of the Chinese medicine in treating the febrile disease and the discussion and the mechanism of the TCM in treating COVID-19. First, I'd like to introduce the World Federation and Acupuncture and the Moxibustion Society. The WFAS is an international federation united organization specialized in acupuncture and TCM medicine and traditional Chinese medicine. It was founded in 1987 with headquarters in Beijing in China. And WFAS established the official relation with the WHO in 1998. It's in special consultative status with the United Nations, and it's category A liaison to the Technical Committee and Traditional Chinese Medicine of ISO. WFAS now has 256 member society from 60 countries and regional representatives, 400,000 acupuncture professionals. WFAS works with the member society and cooperates with the health authorities, educational cultural institutions, and many others facilitate international exchange of knowledge, experience, data, and the visual concerning acupuncture. And the WFAS is amongst the organizations which first react to the COVID-19 pandemic from as early as February. It works with WHO to share knowledge and experience of the traditional medicine in concerning COVID-19. It raised donation to help those areas affected by the pandemic. It initiated the multilingual international lecture on COVID-19, inviting from to line doctor and academician and exposed to share their experience, review, and the latest research result, and organize online consultation which exposed to the traditional Chinese medicine, providing a solution to difficult cases in various countries. I hope this conference will lead to closer communication between the Chinese medicine and the traditional medicine for the America. In China, the strategies to tackling COVID-19, including quarantine, lockdown of city, supportive therapy, and the traditional Chinese medicine therapy. At the present, in the present, some countries are learning from China and adapt to the strategies like the quarantine, supportive therapy. And however, in China, 91% of COVID-19 case, COVID-19 case used the TCM, and 19% of them showed improved condition. This is resulting of the take-line COVID-19 in China. As we know, and the febrile disease is a general term for external contraction disease that's characterized by the fever and induced by virus factor. It could be sepsis, and it could be also be induced by bacteria and the virus infection. And finally, leads to microcirculatory disturbance, shock, and even multi-organ injury and death. In the theory of the traditional Chinese medicine, the heat to toxin could induce the blood heat and the stasis syndrome. The therapeutic method is called clearing heat and corroding blood. It's containing a lot of detail. Some have learned focus on the febrile disease, including by cold. The Bai-Hu-Tang is used for treatment of Yang-Ming syndrome, and the Ma-xing Shi-Gan-Tang is used to clearing lung heat. In the Ming and the Qing dynasty, Wenbing was development in this theory. Disease-induced heat toxin is invaded into 4 stages, and the Wei, Qi, Yin, and the Xue aspect syndrome. The disease is treated according to this stage in China. This theory is very important theory and the method to treat febrile disease. This video shows the normal capillary and alveoli in right lung. The average distance between the capillary and the alveoli about 1 micrometer, which enable exchange of the oxygen and the carbon dioxide effectively. The COVID-19 patients is severe and critical stage, all have sepsis and acute respiratory distress syndrome, ARDS syndrome, which are lack of efficient therapy. In normal condition, the distance between the microvessel and the pulmonary alveoli is very short. which facilitate oxygen and carbon dioxide exchange. However, in pulmonary microcirculatory disturbance, leukocytes adhere to the vascular wall, immigration out of microvessel, and the infiltration the lung tissue. Meanwhile, the plasma albumin also leakages out of blood vessel in the water. This change extends the distance between the microvascular and the pulmonary alveoli, which affect oxygen and the carbon dioxide exchange, resulting in increased carbon dioxide, decreased oxygen pulse pressure, dyspnea, and finally induced systematic ischemia and hypoxia. During the progress of the COVID-19, critical patients are normally accompanied by sepsis and AIDS, which is closely related to LPS-induced microcirculation disturbance. The microvessel consisting arteries, capillary, and the vein, which account up to 19% of the vascular system in whole body. Blood circulation, gas blood exchange, and the body fluids exchange that occurs in the microvessel is called microcirculation. In the early stage of sepsis, vascular endothelial cell damage is staining the blue. This area, this endothelial cell damage can be observed at early stages such as 30 minutes in the 1 hour. On the other hand, upregulation of selectin expressions in the endothelial cell and leukocyte-induced leukocyte rolling in the endothelium. In addition, increased expression of the adhering molecular induced leukocyte adhering to the vascular wall. This adhere to leukocytes to the endothelium and the electron microscopy. The adhered leukocyte injury the endothelium and the further immigration out of microvessel, which called leukocyte infiltration. Unfortunately, no drug available to detach the adherent leukocyte from the endothelium. Vasoactive substance released from degraded muscle cell of the microvascular induced vascular hypermobility is well. Albumin out of microvessel, which is mediated by the both opening of the endothelial gap junction and the carvolum. At this point, it's carvolum dependent trans-endothelial transport. However, fewer drugs can be used to regulate the gap junction and the carvolum, so they are not effective strategies in treatment of the microvascular hypermobility. The damage of the basement member followed by endothelium injection induced hyperreach. The adherent leukocyte, the larger one is leukocyte and the small is platelets. The adherent of leukocyte and platelets to vascular fracture-induced thrombosis. The COVID-19 invaded our respiratory mucosal and digestive mucosal, which called Wei aspect syndrome in Chinese medicine. The COVID-19 damaged interstitial mucosal and subsequently LPS entraps into blood, which induce the leukocyte adhesion and the cytokine release. We call this stage is the Qi aspect syndrome. LPS further induced the microvascular endothelial damage and consequently albumin leakage out of the microvessel, which call Yin aspect syndrome. The LPS induced the endothelial cell and the microvascular basement membrane and induced the hemorrhage, coagulation, and DIC. We call this stage is the Xue aspect syndrome. Each stage, including complicated physiological process. In fact, there are at least 6,700 proteins in one cell of our body. The abnormalities of the protein network is basis the disease. The single component drug can resolve the one or several target protein. However, this is not enough for regulation of the protein network abnormalities. This advantage of the TCM is to differentiate the complicated change to different subtypes in the first, and then regulate each part by multi-components and the compatibility of the TCM effectively. Based on the different chains of the Wei, Qi, Yang, Xue aspect, the TCM compare with the symptom and each stage of the coordinating with the efficiency. For example, for the Wei aspect syndrome, we use the Yin Qiao San and the Sang Ju Yin. When it comes to Qi aspect syndrome, we can use the Qing-Fei-Pai-Du-Tang and or Ma-xing Shi-Gan-Tang. When it comes to Yin aspect syndrome, we can be treated with the Qing-Ying-Tang or Shen-Mai-San. Furthermore, if there is hemorrhage in the blood coagulation or DIC, we use the Xi Jiao Di Huang Tang. There are the major TCM formula used in the 4 stages for the febrile disease. This table, so the TCM formula used in coordinating, which are recommended by Chinese governments. As shown in this slide, different stages of the coordinating disease were treated by different TCM. Among them, the Qing-Fei-Pai-Du-Tang is one of the major TCM that had been widely used to treat mild, moderate, severe patients induced by COVID-19. And the clinical effective result was up to 19%. Therefore, I'd like to introduce some data of Qing-Fei-Pai-Du-Tang. The Qing-Fei-Pai-Du-Tang consists of 21 components that come to 4 Chinese class formulas such as Ma-xing Shi-Gan-Tang and Xiao Cai Hu Tang, Wu Ling San, and Se-Gan Ma-Hong Tang. Leukocyte adhesion to the venular wall is an early stage of tissue inflammation and edema. And there is not good treatment in the current. This image are observed by intravitreal microscopy. Compared with the control group, a larger amount of the leukocyte adhesion to the pulmonary microvascular wall was found 6 hours after LPS stimulation, which sustains until the 24-hour. However, both pre-treatment or post-treatment with Qing-Fei-Pai-Du-Tang attenuates the leukocyte adhesion to the pulmonary microvascular. This slide shows the image of the FITC label albumin leakage from pulmonary microvessel. The albumin leakage out of microvessel was observed in both the 6 hours and the 24 hours after LPS stimulation, which was attenuated by pre-treatment or post-treatment with Qing-Fei-Pai-Du-Tang. There are Wright's lung tissue histological image of each group compared with the control and the control plus Qing-Fei-Pai-Du-Tang group. The LPS stimulation for 6 hours over 24 hours induced the edema through the lung microvessel and the inflammatory cell infiltration, which was attenuated by Qing-Fei-Pai-Du-Tang pre-treatment or post-treatment. In this slide, we can find that 2 formula used in pre-clinical stage and the 4 formula in the mild, moderate, severe of the diagnosing patient and the early stage of critical condition, all of which containing Ma-xing Shi-Gan-Tang. Therefore, I'd like to introduce some data of the Ma-xing Shi-Gan-Tang. The Ma-xing Shi-Gan-Tang from Sanghan Lun, which consists Ma Huang, Xing'er, Sigao, and Gan-Tang. The rat lung injury model was established by LPS injection. The Ma-xing Shi-Gan-Tang over physiological saline was given by gavage 6 hours after LPS injection. The lung injury was assessed the 6 hours, 12 hours after LPS injection respectively. The cerebral vessel was assessed 72 hours after LPS injection. Compare with the similar group, the leukocytes adhesion to the lung venular wall was observed the 6 hours after LPS injection, persisting still 12 hours after LPS injection. However, post-treatment with Ma-xing Shi-Gan-Tang from LPS injection 6 hours markedly reduced ameliorated leukocyte adhering to the lung venular wall. The mechanism of which is to inhibit the expression of ICAM1. You can see here, after 6 hours, 12 hours, the ICAM1 expression was increased. For treatment with Ma-xing Shi-Gan-Tang inhibited this increase. In sepsis, a large number of the leukocytes stick to the microvessel wall. This adhesion to leukocyte immigration out of the microvessel, albumin, and the water also leakage from microvessel, such affecting the normal ventilation function of the alveoli. The Ma-xing Shi-Gan-Tang also ameliorating the LPS-induced inflammation. Look at this image. The numerous MPO positive cells were observed in LPS 6 hour and the LPS 12 hour group, which was ameliorated by Ma-xing Shi-Gan-Tang post-treatment. These results were confirmed by assessment of the MPO activity in lung tissue. In the 6-hour and the 12-hour, the lung tissue, the MPO in the lung tissue activity was increased. However, post-treatment with Ma-xing Shi-Gan-Tang from 6 hours after LPS injection ameliorated the MPO activity. The MDA contents also increased at the 6 hour, 12 hour after LPS injection in lung tissue, which was ameliorated by Ma-xing Shi-Gan-Tang post-treatment. It is well known that endothelium permeability is regulated to different cause pathways. One is transcellular pathway. The other one is paracellular pathway. The transcellular pathway is a cavallo mediated vesicular pathway, and the paracellular pathway is mediated by intracellular junction, including tight junction and the adherent junction. The third, phosphorylation induced phosphorylation of VE cadherin, the one of the adherent protein, in the cavitating one. This is important for the signal pathway. The cadherin fiber is one of the tight junction that maintain vascular barrier integrity and play important role of the pulmonary interstitial edema. LPS induced the cadherin fiber decrease expression and the fracture, not continuous in lateral lung microvasal endothelial cell. However, post-treatments with Ma-xing Shi-Gan-Tang recover these abnormalities of cadherin fiber regiments and expression. And post-treatment with Ma-xing Shi-Gan-Tang ameliorated the pulmonary interstitial edema. Post-treatment with Ma-xing Shi-Gan-Tang also upregulated the expression of GEM1, occluting, and 6 hour, 12 hour after LPS injection, which recovered paracellular hypermobility induced by LPS injection. The cavitating-1 is the structural protein of the cavallo that's mainly expressions of the endothelial cell, and the media albumin transcellular transport. The 6 hours after LPS simulation, the cavitating-1 phosphorylation increased markedly, and the 12 hours no recover. However, post-treatment with Ma-xing Shi-Gan-Tang from 6 hours, the cavitating-1 phosphorylation was significantly inhibited. Third, Ma-xing Shi-Gan-Tang inhibited transcellular pathway dependent albumin leakage. By the binding with the receptor TROLAC4, LPS activity, SERC, kinase activity, and enable kappa B translocation from cyto to nuclear. 6 hours after LPS assimilation, the TROLAC4 expression increased. Circular phosphorylation also increased. Enable kappa B and the subunical P65 submunical translocation, the nuclear. Post-treatment with Ma-xing Shi-Gan-Tang inhibitor TROLAC4 higher expression and circ phosphorylation and MLKB subunical transnuclear. Assessment of the infiltration cytokine further confirmed the anti-inflammation potential of Ma-xing Shi-Gan-Tang. You can see LPS increased the level of the TNF alpha in serum, buffet, and the lung tissue at 6 hours and 12 hours. However, post-treatment with Ma-xing Shi-Gan-Tang inhibits this increase. On the other hand, the cytokine IL-1 beta and the IL-6 in serum was increased at 6 hours and 12 hours after LPS injection. Post-treatment with Ma-xing Shi-Gan-Tang inhibits this increase. The LPS decrease mean blood pressure and increased body temperature and heart rhythm, and 6 hours persists still 12 hours, which was significantly ameliorated by post-treatment with Ma-xing Shi-Gan-Tang from 6 hour LPS injection. In addition, LPS challenge for 6 hour, 12 hour increased carbon dioxide, where decreased oxygen saturation and partial pressure of the oxygen and 6 hours and 12 hours, all of which were ameliorated by post-treatment with Ma-xing Shi-Gan-Tang from 6 hours after LPS injection. The LPS reduced survival result starting from 12 hours after LPS injection, reaching 46% and 24 hours. Post-treatment with Ma-xing Shi-Gan-Tang increased survival result to 80%. Our research confirmed that Ma-xing Shi-Gan-Tang inhibits the LPS-induced toll-like flow expression, circular phosphorylation, and recover B subunit nuclear translocation, which induced leukocyte adhering to the visual wall and induced inflammatory cytokine release. In addition, by the inhibiting the activation of the circ-CAVD1 signal pathway, as well as the meantime, the intercellular barrier junction targeting the Ma-xing Shi-Gan-Tang ameliorated the lung edema. Therefore, the Qing-Fei-Pai-Du-Tang and the Ma-xing Shi-Gan-Tang can be used for treatment of the Qi aspect syndrome. When the heat toxin come to Yin aspect, the blood-brain barrier damage, the albumin and the water also leakage from microvessel, which clinical manifestation is uncosoleness. The larger amount of the water leakages out of microvessel, then the blood volume decrease and the pores become tricked. The water leakages out of microvessel where the red blood cell remain in the blood vessel. The blood is sick. the theory of the lineage from microvessel, which need to wait. The LPS injection, there were lots of research. Qing-Ying-Tang. When we examine the infrastructure,
Apologize because apparently the Dr. Han connection have some technical issues. Dr. Han, can you hear us?
Yes.
I'm sorry. Is that we lost you in the last 3 minutes? Apparently yes. Something was working bad with your connection, but yes. now we hear you again. Dr. Han? We are resolving the issue.
Post-treatment with Qing-Ying-Tang inhibits the LPS increase. This is immuno staining and the blood vessel. So
Dr. Han have lost his connection. Oh, okay, we apologize with everyone. You have to understand that in China right now are 11:20 p.m. Dr. Han is presenting apparently some issues with his connection. Maybe now, Dr. Han, can you hear now? Can you hear us now?
Okay.
Okay. So sorry. So sorry. we will do a test more. We had a proposal. We have a proposal. Just in case if the connection continue with fails, our idea will do a record. We will do edition of the transmission, and then everyone will be able to see this lecture in the YouTube. Just to know, we know and we know that the technical issues are not helping to understand all the great and important information that Dr. Han is sharing with us. Just for all the attendance, we will do our best to resolve that in order that this information arrive to everyone. Please be patient, and thank you for your understanding. We will do a test more, and if the connection fails, we will continue with our academic program, and then we will do a record. We will resolve for the lecture issues, and then you will be able to attend that lecture in another moment. So please, Dr. Han, continue. We hope that now all the technical issues could be resolved. Thank you.
Okay, just about 2 minutes, I will finish my talk. And when the heat toxin come to Xue aspect, the Xi-Jiao-Di-Huang-Tang should be used. The Xi-Jiao-Di-Huang-Tang, including Xi-Jiao, Sheng-Di-Huang, Shao-Yao, Mudan-Pi, the medicine which the function of the cooling blood and the hemostasis is Sheng-Di-Huang. The blood entering components of the Sheng-Di-Huang is the catable. This is its structure. The bleeding was found 30 minutes and 2 hours after LPS injection. However, treatment with catable, the dosage is 10 milligram per kilogram or 30 milligram per kilogram, markedly inhibits the bleeding. After LPS infusion, the basement member of the lung microvessel was broken. The red blood leaked. However, treatment with the catable inhibit the basement member injury. LPS can activity circ by binding to toll-like flow, which can activity funk, which induce the degradation of the funk adhesion and the damage of the basement member. On the other hand, circ activity PI3 and the AKT and the cut piece B, which degraded collagen 4 and the laminin in the basement member, such damage the basement member and induce the hemorrhage. However, the catable inhibits the higher expression of the toll-like flow induced by LPS stimulation and inhibit the phosphorylation of the circ, PI3 kinase AKT, and the funk. Catable also inhibits the increase of the caspase B activity induced by LPS injection. So, catable can inhibit the hemorrhage after LPS stimulation where severe signal is possible. Basis and the difference of the way Qi in Xue aspect, the TCM, cope with the symptom and each stage of the COVID-19 with the efficiency. Therefore, the treatment plan recommended by Chinese government. It's not a single drug. It is a systemic approach which comes from the theory of the febrile disease in TCM. Thank you for your attention. Okay, my talk finished.